Good evening, sir, and thanks very much for your time. Where is the biggest need right now?
The biggest need is in Beira, that is Mozambique, where it's a city of about 500,000 people, and the infrastructure there has been completely destroyed, of course, almost about 90%. As a medical organization, of course, we focus on healthcare, and infrastructure of the medical facilities has also been completely destroyed. The hospital, we were working together with the Ministry of Health, providing advanced care of HIV, was partially destroyed. So the situation in Beira is really bad.
Mm-hmm. And how big is the burden of disease? I mean, on the back of the cyclone?
It's huge, because if people do not access health facilities now that has been destroyed, the situation, of course, worsens. Those who are sick, they continue to become more sick, and the waterborne diseases is prone to actually exacerbate the situation and increase the disease burden in the region. We are treating now watery diarrhea. We are treating all other infections that are there at the moment. At the same time, we are trying as much as possible to prevent waterborne diseases by offering the tablets that could actually, like chlorine tablets, to purify the water so that it can be drinkable. Because the city itself had running water that was treated, but this reservoir has run out, and the population now, of course, will require clean water. So that is our first intervention, is to focus on the healthcare as much as possible, try to prevent the aftermath of waterborne diseases.
So what are you appealing for? What do you want? I mean, to people who are watching, you know, what do you want help with?
Yeah, South Africans have been very kind to us and have been donating to us. We like to ask them to continue donating and possibly raise their donation at this particular moment. Doctors Without Borders would like you to go to visit our page, www.msf.org.za. You click Donate Now. You can actually go there and select what country you want to donate, if it's Mozambique, Zimbabwe, or Malawi. We are in all those three countries offering those services. We are in Chimanimani now, where a population of 30,000. We have accessed the district. We're working with the Ministry of Health to provide services. We are in Sanje, in Malawi, where we also provide health services over there. So we appeal for those who have been donating to us and those who want to donate, who are new donors, to come on board and support us during this time.
Mm-hmm. And as you say, I mean, while the biggest need may be in Mozambique, I mean, Malawi and Zimbabwe should not be forgotten either.
It shouldn't be forgotten either.
Those things may just get worse.
Yes, exactly, yeah. In Malawi, 14 out of 28 districts has been flooded. This was an agricultural place where you can imagine the food production has been destroyed because water has already run into their farms and stuff like that. So we expect the aftermath of this cyclone to actually continue for several months to affect population in all those three countries.
But are there new methods now of sort of mitigating the effects of disasters like what was brought about by Cyclone Idai? In other words, once this thing happens and there are places whose crops and everything gets destroyed, then this is in addition to or over and above the diseases. Are there ways to sort of mitigate the impact? Do you bring more medicines? Do you
I think what we there's no better way of saying that you really prepared for a disaster. But we try as much as possible to ensure that we have been doing this for quite some time. So we have things like we call kits that can come in handy, and actually it's been set up to do something a bit more faster than usual. We can do rapid tests now that we couldn't have been able to do them before. So all these things put in place can actually help us to work faster. But to say that we can prevent the cyclone.
Are there food stuff that people sort of eat which help them to heal faster, or which at least make sure that they don't go hungry even if they eat small amounts? I'm talking about
yes,
there's
also nutrition supplement preparations of like things like plum peanut, for example, that we use in nutrition campaign in terms of droughts that could actually be used. We have ordered them also to come on board. So these are ready-made type of food that you don't have to actually go and prepare. So put up fire. There's no place to put up fire. It's all wet all the time. So this type of food they can actually eat, and it adds a bit more calorie so that you don't have to eat too much of it as well. Those are things that we provide to actually make it more bearable and more sustainable, that we can actually work to reduce the burden of diseases.
Remind us again, where do people who want to help go?
You'll go to our website, www.msf.org.za. They click Donate Now, and then they can select what country they want to donate to, if it's Malawi, if it's Zimbabwe, if it's Mozambique. So all those options are there. And Doctors Without Borders has been very kind to receive all those donations.
So, thanks very much.
Thank you.
For coming through. James Kambaki from Doctors Without Borders.